Welcome to Nursing School Explained in this video about fluid compartments, which is really critical into understanding the principles of fluids and electrolytes and how they move across the semi-permeable membrane. So in the body we have our cells and we have our blood vessels. So we have here our cell and our blood vessel. So everything in the intracellular fluid contained within the cell is called ICF, or intracellular fluid space, and that's about 65% of the entire fluids of the body are contained in the cells. Now within the cells we predominantly have the following electrolytes: potassium, magnesium, sulfate and phosphorus. Now that doesn't mean that potassium does not exist in the intravascular space, but predominantly potassium sits in the intracellular space. Now then over here we have our blood vessel, which we can also call our intravascular space, so inside the blood vessels. And that fluid contains about 7% of the body's entire fluids. And in the intravascular space, the predominant electrolytes are sodium, chloride, bicarbonate, and calcium. Now, in between the two, in between the cell and the blood vessel, we have what's called the interstitial space. And that's why when fluid accumulates here, it's also called third spacing, because it is a third space of the fluid compartments. Now the interstitial space and the intravascular space are outside of the cell and therefore are called extracellular fluid or extracellular space, meaning the 35% that we need to make up the difference of the 65% of the intracellular and extracellular fluid. Now in that third space, fluid can accumulate also, and there are certain conditions where that tends to happen. But here we have the cell membrane, and think about this as a semi-permeable membrane. So by diffusion and osmosis, the particles move back and forth here across the semi-permeable membrane. And keep in mind that particles move by diffusion. And by particles, I mean electrolytes. And then osmosis, wrong color, osmosis is water, or H2O osmosis. So depending on what the body needs, by diffusion and osmosis, it moves the particles and the water across the semi-permeable membrane to make an equal compartment. Now, something else that's important to know here is that the only thing we can measure is by putting a needle in here into the patient's vein and measuring the patient's serum. So measuring their blood. When we measure the patient's blood, we know that typically in a blood sample, the sodium concentration should be a certain number, should be a certain concentration. If that is not the case, then we know the sodium has moved, most likely in exchange for the potassium. So things move constantly back and forth, and we know by measuring the serum concentration of sodium, potassium, and all these values, this is what we expect. There's no way for us to know what's going on in the intracellular space, but by knowing the principles of diffusion and osmosis and the concentrations that we should expect, then we know how to measure the serum and what's normal and abnormal, and then we can base our fluid administration, our IV fluids, on the patient's needs and the current state of their serum and the concentration that they have. So I hope this has helped you understand the fluid compartments, intracellular, extracellular space, as well as interstitial and the intravascular space. Also check out the other videos in the series where I talk more about diffusion and osmosis, as well as other principles that relate to fluids and electrolytes, so that you can really get a better grasp of this complicated topic. Thanks for watching.